So I grew up in the Philadelphia area, and I moved out of state for undergraduate. I was at Duke University. Ended up coming back to the Philadelphia area to be closer to family for medical school, and I went to Thomas Jefferson University. Then I moved to Ann Arbor, Michigan, and did my internal medicine residency at the University of Michigan in Ann Arbor. And ultimately came to the Boston area, first time in my life, and did all my subspecialty training here in Boston. I was at Boston Medical Center for Pulmonary Critical Care, and then I did a sleep fellowship at Beth Israel Deaconess Medical Center, and stayed there, for a number of years as faculty until I recently transitioned here. In pulmonary medicine and in critical care, there is a lot of overlap with sleep medicine from the breathing standpoint. In the ICU, we are exposed to both, chronic hypoxemic and chronic hypercapnic respiratory failure, and we do manage patients with non-invasive ventilation. And so my initial interest was really due to this overlap with pulmonary and related to the sleep breathing issues. As I learned more about it myself, I just became more and more interested. Because I'm a subspecialist, most of the time patients are referred by other doctors. There are patients that sort of self-refer. They, are able to with their insurance and feel that they have sleep issue that warrants seeing a specialist. But I tend to see patients from all different areas. So they may be referred from a neurologist, from psychiatry, from my colleagues in pulmonary because of overlap syndrome, COPD, and sleep apnea, or hypercapnic respiratory failure. When a patient comes to work with me, I would like them to realize that I think of us as a team. I think it's very important that there's open communication, listening, patience. I take a lot of time with my patients and really probably ask questions that maybe they've not been asked before, because to really manage their sleep issues, I need to understand a lot about their lifestyle, their habits, their environment, their sleep approach. So what works for one person simply may not work for another individual. And so it's very important to understand that individual, identify what their concerns are, what changes they're willing to make or that they're capable of making, and meet them where they're at, and then work together to continue to improve their sleep and basically their function.